Hi, do you ever wonder what to expect when you go to a pelvic floor physical therapist? You might have had friends that say to you, hey, I'm going to pelvic PT, I stopped peeing my pants, and all this great stuff, right? Your doctor might say, hey, you need to go to pelvic floor PT if your hip hurts, or if you're having low back pain that hasn't been resolved with regular PT, or maybe you're having difficulty with intercourse, or simply maybe you're constipated, or there's a million things. So physical therapists who work with pelvic conditions, they focus on getting to the root cause of what is causing your issues. So whether that is incontinence or low back pain or hip pain or difficulty with intercourse or inability to climax, these are all things that a pelvic expert physical therapist can really help you with. So after that, you might be a little bit scared. So we find that it takes people like 9 to 15 times to get referred to pelvic floor PT before they actually go to physical therapy for their pelvic floor. And so I want to just clear the air and really discuss what the initial visit for a pelvic expert physical therapist looks like here. Before I lose my camera. So what this looks like is, let me get this right here. Cool. All right. So a pelvic expert physical therapist will do a deep consultation with you and kind of explore your whole history, from your athletic history to your birth history, or whatever that may be. And so after exploring the history, they'll do a full assessment externally of your neck, your back, looking at your whole skeleton, your alignment, your posture, and really correlating what they're seeing with your symptoms and really where you want to be. So, whether that's you want to run a marathon without hip pain or you want to get pregnant. So they can help you do all these things. So when it comes down to the actual internal examination, this is typically done intravaginally. So what that means is through the vaginal opening. So a pelvic floor physical therapist is going to look not just at the internal structures, but they'll look at the external structures. So they might ask you to contract your pelvic floor, or we say, do whatever you think a Kegel is. Now relax your pelvic floor. And then they might say, bulge, like you're trying to fart. And we always tell people it's okay if you fart, and that's good because we're asking you to do that, even though it sounds silly. So after that, then if you're comfortable with us proceeding further, then we'll do an intravaginal assessment assessing the pelvic floor. So the pelvic floor is 3 layers. You see the pelvic floor here. We have our vagina, our anus, urethra, and clitoris. Okay, so those are some of the major structures here. So bowel health and bowel function is usually what we're looking at when we're looking through the anus. Vaginal health is going to be all things related to intercourse and childbirth. Then urethra is going to be your urinary system. So can you pee? Do you pee every 3 to 4 hours, or are you going more frequently than that? Do you have a lot of urgency? So we'll just explore different things. With the clitoris, we're wondering, can you have an orgasm? Is that orgasm painful? Does it come on easily, and can it leave your body easily? Or is there cramping, or is it hard to get an orgasm? So we're looking at all different pieces of the puzzle when we're exploring your history, and then we're correlating that to what we're finding from your physical examination. So a therapist will also insert a finger vaginally, and they'll look at these superficial muscles. So there's 3 layers. We're going to look at the first layer. The second layer isn't pictured in this model. And then the deeper layers are going to be inside the bowl. So really inside the pelvic rim. So a therapist will explore the muscles. They'll look for adhesions, trigger points, scar tissue, anything that they find tightness. They're looking at the quality of the muscle. So does it feel soft and squishy and healthy? And can it contract, relax, and bulge? Can it do that from the superficial layers and the deep layers? So we're physical therapists, they're looking at all of these pieces and really figuring out how we can help you and where we find the issues. Is this uncomfortable? Well, It is, but can also be very relieving, and it might not be uncomfortable. So a healthy, happy pelvic floor is relatively pain-free. You might feel some pressure points, but you won't necessarily feel pain. Now, if there's some scar tissue, it can often feel like burning, or some people say like a fingernail, and that's more of the fascial structures being stretched, or the scars being stretched, and so people will use those words to describe that here. But those are what most people feel after they're done with a pelvic floor examination. Is they'll feel relief, they'll feel good, they'll feel like maybe they've had this hip pain or back pain for years, and they're like, oh my gosh, that's the first time someone's been able to recreate my pain. Or maybe they experience like painful, with intercourse, they'll experience like deep thrusting pain, and then the therapist will hit a certain muscle, and that will be the pain that they've been experiencing all their life. And then the therapist will work on that area. And yes, this is all happening intravaginally. There are some conditions, maybe it's tailbone pain, or dysfunction, that need to be assessed intrarectally, and that would be through the rectum. That's a little less comfortable, so we don't always start there. At least for women, we don't start there. So I hope that answers your question on what a pelvic floor examination is and what it looks like. And none of this is done without the patient consent. And if at any point the patient is uncomfortable, then we stop. And there's many things that we can help you with even without treating these internal muscles. But much of the time, getting a pelvic floor assessment will allow you to get to the root cause of whatever you're experiencing, whether that be low back pain or hip pain, or leaking urine. So hopefully that makes sense, and we are super excited that you're even watching this video, and hope that you find the help that you need. All right, take care.